But I had never heard of it, and I was a journalist who was specializing in diabetes. And so that kind of blew my mind. It was never discussed as a possible complication from diabetes. I didn't have any idea that someone like myself, someone who had ED and a long history of diabetes, could get peronies.
Peronies is a really difficult subject to talk about. You certainly can't advertise for it in any normal way. And we know that it's relatively common. We don't know exactly how common, but a realistic assessment of its prevalence is maybe 5% of adult men. So that's pretty common. Their erections are not as good, so they're more subject to injury. They don't heal as well, so they may have problems with the healing. They may have low testosterone, which can have a role in healing and so forth. And because guys aren't talking about it, they don't know that there's any treatments available.
I wish the peronies was part of just the general health conversation when you go see a specialist about your sexual health.
Providers are very worried about embarrassing patients. They don't know what it is they can ask without the patient feeling bad about themselves. And the patient may not want to bring up the issue either because they're embarrassed about it, or they don't want to embarrass the provider about it, and so neither one brings up the subject. And I think that's unfortunate. I think it should just be something that's asked about just like everything else that's asked about.